This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by the...
There's so many words.
So many words.
Just
debonair, Dr. Jason Martin, MD.
What was the word you used that I really liked? It was something about dressing really nice. Not exquisite. What was it, Nils?
Dapper. Resplendent.
Resplendent.
Yeah.
Yeah. I feel resplendent today. I'm not wearing my scrub bottoms. I'm wearing my
Winnie the Pooh in it?
chinos. I'm wearing my chinos. Don't have my glasses on. My hair slicked back.
All right. It's a good look.
I'm ready for date night.
Well, it is February 1st. You're ready for Groundhog Day.
Oh, that's true.
Mm-hmm. Yeah. So this is going to be a great episode. And I actually was inspired to do this episode because I think it's something that is not talked about enough. We talk a lot about what to expect, right? We have many episodes. I think we even have several on what to expect during recovery or what to expect, fill in the blank. Every episode we do where we talk about a specific procedure, we talk about what to expect.
What to expect.
What do we not talk about?
I would go as far to say what to expect is probably the most things we talk about.
Yeah, we probably do talk about that. I mean, that's kind of our thing. We talk about what to expect.
Yeah, what is it like? How is it going through surgery? Mm-hmm. What's it like afterwards? What to expect.
Downtime.
Yeah.
What we don't talk about a whole lot is what not to expect. Or what you might not have been expecting.
That really brings it in. That really closes the walls down. We can scope it in. Mm-hmm. So you know what to expect, but here we're going to talk about everything else.
Well, it's more the things that no one expects is really what we talk about today. And before I forget, if anyone is listening to this podcast and want to watch us on YouTube, you can find us at Jason Martin MD on YouTube. There is a video that goes along with this and a few slides. They're not super interesting slides, but you do get to see us if you're
You get to see me without my glasses and my chinos on.
I like it. I can see your eyes.
Yeah, I can see your eyes too.
Yeah.
You have nice blue eyes.
You have nice blue eyes too.
There we go. I have a fist bump on that. There we go.
It.
Good job.
I almost destroyed another doctor this week with my powerful fist bump.
Oh, you did?
Yeah, he was not expecting it.
No,
it went like this, right? Yeah. I'm like fist bump and I would use your other hand.
Okay.
And I just did a normal fist bump, right?
Oh, yeah.
And he was like, ow. And then I went in again and like really hit it.
Yeah. You should have come across with an elbow like after that, too.
I mean, that felt like maybe taking it too
UFC.
far. But yeah. So it's a good conversation to have, though. And we talk a lot about things you should ask at pre-op, all the things that are normal that people might not be expecting that we think are normal. But there are definitely things that happen that we weren't even expecting. Doesn't mean they're, outside the realm of possibility, but there are definitely things that, what do you do if one of these things happens to you?
Right.
One of these very unexpected things might come up. And that's what we're going to talk about today.
And for the patients, it's very distressing.
Yeah.
So I think it's good to start thinking about this if you're thinking about surgery. If you went through this, it's probably helpful to hear us talk about it. I think some of the things in plastic surgery, the problems in plastic surgery really come with knowledge, empowerment, et cetera, which is why we're doing this podcast. So today is about hopefully starting a discussion that can be empowering to you as a patient and help you in the future if you decide to do plastic surgery. Also, we'll try to make it entertaining. That's questionable. We'll see how it goes.
We'll see how that goes. Yeah. Well, let's jump right in. So this is what we all think recovery will be like.
Oh, yeah. She's doing a little yoga. What is that position?
That
if you look on the YouTube channel, Jason Martin.
Extended side angle, right? No.
I don't know. My wife does that pose.
Yep, you come out of warrior.
I know. The lady's kind of, I don't know, going to the side with her hand up in the air.
From warrior 2, you put your one hand on the ground, your other hand up in the air. I think that is extended. That's extended warrior.
That's extended warrior.
Yeah. I do a lot of yoga, but I use it to zone out. So that's not the point of this picture. So what do people think recovery is going to be like, Dr. Martin?
Well,
you've just had 7 hours of surgery. You spent the night in the hospital.
Oh, I just saw the two ladies today, the friends, right? And they're like, man, I got some discomfort. I'm like, you had surgery yesterday.
Less than 24 hours later.
I would assume you would have discomfort. You know what? You probably don't feel well either, right? And they're like, oh, yeah, you really know what you're talking about. I'm like, that's
tired.
expected. This kind of hurts. So I think that the first problem, even if people prepare and they read about it, right? It's just the reality hits afterwards. And then they have discomfort. They feel tired. They can't move. They get frustrated. One of the patients today had a little bit of anxiety, which is totally expected.
But see, that's what they think. Like what I'm
Right.
saying is this is what people, they think that recovery is going to be a day or two.
Oh, yeah. I'm sorry. Yeah.
Right?
Yeah.
That they might have mild bruising for 24 hours. That they will absolutely be wearing their skinny jeans on day 2 post-op, which in my mind
After
means
liposuction.
no swelling. Yep.
Yeah.
Because they wore their skinny jeans home from delivering their baby, so they assume that after their tummy tuck, it'll be the same way.
Right.
And they'll be back to all their normal activities, driving, housework, work, taking care of their kids, in a few days.
Right.
That's what people think. And I think,
And the websites pretty much promise that too.
no downtime, lunchtime procedure.
Lunchtime facelift.
Yes, no bruising, back to work in a day. And there are times when, we might say that, yes, you can be back to doing XYZ activity in several days. Well, you take that. This is my rule with snow totals in Denver. So in Colorado, I grew up in a very mountainous part of Colorado where
Oh, we
it
don't know
snowed all
that.
the
You've
time.
never referred to that 1,000 million times.
They might be new.
Okay.
So I would basically take,
She
watch.
grew up in Breckenridge
I grew up in Breckenridge,
on a small dirt road,
10,000 feet.
10,000 feet in the air.
I'm a mountain person.
Yes.
So, you'd watch the news and they'd say the storm was going to drop, 18 to 24 inches. Well, I would just take that number and cut it in half. So, we would maybe be getting 9 to 12, right? To set realistic expectations. And I think that's what people do. They hear us saying, you can't drive for 7 days.
So
and
they think we're meteorologists?
Well, no, they
With our
take
computer system?
Yeah. I think they think we
We're
overestimate.
forecasting a 2-week recovery. But, this is all computer modeling. So we'll have to wait and see how the high pressure comes in.
Well, no, it's because you think that you're.
I just think it's very funny.
Yeah.
But yeah, I got you.
It's that same idea,
It's so
though.
true. It's the way human brains work.
Yeah. Dr. Martin says, I can't do this for 7 days. Oh, I'll be back in 2.
Yeah.
It'll
Dr.
take
Mar-
me 3.
Dr. Martin doesn't know me.
Yeah. I won't swell.
Yeah.
All those things that we think in our heads. And some of it is self-preservation, right? You tell yourself these stories because you don't want to think about being in pain. It's like having a baby. I think you got to think like, no, this is fine. My body knows what to do. I'm going to get through this, or else you would never do it because it's insane,
It's totally insane.
Yes. So I think it's the same way with surgery, but that's, it's a field of flowers. You're literally feeling good in a day. You don't leak. You're not bruised. Like life is good.
Life is really good. Oh,
Yeah.
and by the way, all your personal relationships are great too.
Oh,
There's no stress
they're
there.
better. Surgery made all those things better.
The kids aren't annoying you. Yeah. It's
Yeah.
like a unicorn recovery. I like it.
So that's what people expect, right? This is what you were getting at.
Oh, yeah.
What's the reality of recovery? What recovery really looks like?
Right. It's not linear.
That's, I think, the very first one.
Right.
Like,
That's so true.
physically and mentally, it's not linear.
You could be good for 4 days and then the wheels fall off.
Mm-hmm.
You could be terrible for 2 days and then really good for 4 days. And then the next day something happens and you feel like you're back at the beginning again.
Or you're good for 6 weeks.
Right.
And then you have your off day.
Yeah.
So it's understanding when you go into recovery,
That's a really good point.
it's not always up, but its a general trajectory is up, but it's not going to be up steady. It's like
Yeah.
the climbing the hill thing.
It's not like cryptocurrency. It doesn't just keep going up.
You're right. It does not. It has ups and downs.
Yeah.
But that's normal. And those ups and downs are physical and those ups and downs are mental. So like you might have physical setbacks, like increased swelling, especially when you are feeling really good for a while and you start doing more.
Right.
And then you swell. Or, you might have some little thing happen where you get a bruise after surgery that's way, way more intense than it would have been because you just had surgery there. It's the classic story of like the woman whose dog bumped into her stomach after lipo. And, then she had this massive bruise and she was so upset because she didn't have any bruising. And then she got this bruise from her dog's head hitting her and like end of the world kind of thing. But like, that's part of it.
The way it goes.
Yeah. So, that's real. That's real recovery. How about pain with recovery?
Yeah. I mean, you can have people that have high pain tolerances, supposedly.
I was going to say, yes.
And then after
subjectively.
surgery, it's like they're in the most pain ever. And then you have people that like come into your office. The first thing they say to you, like, look, I'm fine with surgery. I just hate pain. Like, I'm so concerned about pain. And those people do great after a painful surgery.
Mm-hmm.
So it's really hard to predict. It's easier for Amy and I. We've been doing this a long time. We have really consistent outcomes. I know exactly what I'm doing in the OR. And so it's not like, that day just something weird happened. That's not how it occurs. And so there's some consistency in what I'm doing. So it's really weird to have these different types of sensations afterwards, but it's really not because people recover differently. We don't know the genetic makeup of every single person. Like we don't sequence their genes and figure out how they're really going to recover, which would be really cool if we did do that. That would be awesome.
The mental side of that, though, I don't think gene sequencing has not gotten to the mental side of things just yet.
Very, very true.
And pain is subjective.
That's so true. That's true. So, and as Amy is saying that I now, and she already knows this because she's taking care of all these people too, realize that pain is in big part mental, which you've heard that before, and people's recovery mentally can really differ across the board. Mm-hmm. You can be high pain tolerance and really have anxiety and really feel frustrated, and then you feel pain versus the other thing. So, it's with plastic surgery procedures, most of them, besides some of the stuff we do in our office, it's a long haul, and you have weeks of recovery, and some people mentally that can be really difficult on them.
Yeah, and I think a big component of pain is actually fear of pain is what gets to people more than the actual pain itself. A lot of our patients are very active. They've probably had orthopedic surgeries before or some type of surgery in the past that caused them pain, right? They've had pain or they've had a child or whatever. They've had pain. So they assume that this thing they're doing, this big surgery, is going to be on par with whatever highest level of pain they've ever experienced in their life is going to be. So if they come out of surgery and their pain is tolerable, there's still the fear that their pain will be worse. This whole theory of like getting on top of your pain is not really a thing with the types of surgeries we do, because we're not doing things like deep into joints or bones where, yes, that is true. Like if you don't stay on top of like a total knee,
you can get in a bad position.
Yeah, it could take a while for that pain management to get that deep. The things we're doing are soft tissue related. You're going to get pain relief relatively quickly from the type of pain management we provide. I mean, proof of that is the type of long-lasting anesthesia. Like you inject that into somebody's soft tissue and they might not have pain for days. So
we just had that the other day. The patient came in. She's like, she called us. She was really scared. She's like, oh my God, I have searing pain in my abdomen. And when I was seeing her, I was like, what's going on? And then I realized that I had injected the long-acting local anesthesia.
That just so happened to wear off 3 days after surgery.
3 days afterwards, right? It's like, it's pretty.
So it wasn't that the pain she was having was bad. It was that it was new.
Pain. She just literally had pain.
It was new pain.
So,
and that is something we tell people to be aware of, like new pain. And I always say new pain that does not get better with changing positions, taking pain medication, moving around, adjusting bandages, that kind of thing. Like that should not be ignored. But there's that fear. And I think there's the fear of the caretaker too. Like, ooh, I don't want my loved one to feel pain. I'm going to drug them up to within an inch of their life. And that gets tough too.
How often do husbands do that? And I'm convinced they're doing that because they just don't want to talk to their
spouses. I think wives do that too. I mean, I think it's pretty common that you don't want to see your loved one in pain.
Yeah, the worst thing you can do is load someone up with narcotics.
Yeah, because that gets then into the mental up and down.
And then they get depressed.
Yeah.
Depletes them all their, like the dopamine in their brain.
Yep.
And all the hidden like trauma in their head comes out. And then
it slows your digestion. Then you just feel terrible. And then the mind again.
Remind me why we do surgery again. This is sounding terrible.
Well, no, this is
I don't want this.
Yeah. So pain and discomfort, again, is subjective. You will have some discomfort. Even people who may not have quote unquote pain after surgery are still going to have feelings that are different, sensations that are weird, nerve zingers, tingling, numbness, pain. These things can persist for months, even up to a year in some cases.
Yeah.
So just being mentally prepared for the fact that, and I tell people this, even 6 months after you've had major liposuction, if you bump into a counter, you'll know that you had surgery there, and they don't get it beforehand, but after surgery, they understand what I'm saying.
And to the point of this title of this episode, that's not expected, right? So that happens, and that's frustrating. That feels like that puts you back.
Oh, I say it's absolutely expected.
Well, no, I'm saying in their minds,
right.
It's not. Yeah. And we should have named this episode "Expect the Unexpected."
Well, no, but that's just it. The things we're going to talk about that are unexpected truly are not even, we don't expect those things either. Gotcha. So this is what I'm saying. These are the things that are normal that people may not expect, but they're the things we talk about.
I thought we were at the unexpected.
We are not at the unexpected yet. Okay. So bruising can persist for weeks. In some cases, bruising can be a side effect of some of the things we're going to talk about that are unexpected. And bruising is the side effect, and it can last for a very long time. Mm-hmm. We may tell someone to expect bruising for 2 weeks after a face and neck lift or after an eyelid procedure. Some people might have bruising that is somewhat persistent for 6 weeks.
Seen it.
Yeah. Does that mean that anything is wrong? Not necessarily, but it's also unexpected. We don't expect your bruising to last 6 weeks. So that is in the unexpected category. Same thing with swelling. Can come and go for months. Swell hell. Dr. Ryan's favorite.
Facebook group.
Yep.
My Tummy Tuck Facebook group. I'm talking to every one of you guys out there.
The swell hell.
Whoever came up with the term swell hell, I love you. Who was that lady who called in from California? Do you remember her name? We'll have to go back.
I'm not going to say it just in case she wouldn't want it said.
Okay, gotcha.
I don't know if we said it during the podcast where we had the
I just
voicemail.
loved her call-in question.
Yeah.
We need to do one of those episodes again. Those are so much fun.
Leave us your voicemails. We do answer
Yeah,
them.
what's the number? 303-630-9038. Call us.
Yeah, so we had a patient who did leave us a voicemail asking about swell hell that she'd heard of on her tummy tuck groups, and that's literally just persistent swelling. And yes, anytime you're having major surgery that's cutting through lymphatic, especially in an area that's kind of right in the middle of your body where that flow needs to be able to move freely up and down back to your heart. Yeah, swelling, persistent swelling for months. Same thing even in the face. You know, I have a patient who was kind of put out with me because I told her that she could try to sleep on her side at 2 weeks, and she was very upset that at 2 months, her ears felt too weird for her to sleep on her side. And she was really mad at me that I told her that she could at 2 weeks. I said, well, I said you could. I didn't say you would. You know, you can. It doesn't mean you're going to feel comfortable doing that. So some of those sensations are weird and they last for a really long time. But life will get back to normal. It will. I say you'll be turtling for at least a week. And that's pretty much true of most of any surgery that involves anything on the body. I call it the turtle because everything still happens. Like you get dressed, you shower, you sleep, you eat, whatever. You just are the turtle.
Mm-hmm.
Slow and steady wins the race, but it's
Always.
slow. Yeah. So what, any other thoughts you have about like actual recovery that's normal that people might not expect, but that's normal?
I actually think this is a great part of the episode because this is like normal stuff that people don't expect.
Yes.
But I guess we have talked about that
Yeah,
before.
we've talked about these things before. Right. So sometimes the unexpected things do happen. And this is where we deviate from the normal
now
expected.
I know where we're going with this episode. This is making me uncomfortable, Amy.
Yeah, well, this makes me
All
uncomfortable.
the surgeons watching this are like, none of this stuff ever happens.
Right, this
Amy.
never happens. Mm-mm.
Ever.
Right, so these are the things. So when you fill out your...
Did you know this, Nils? Did you know that we were going to talk like this?
Yeah.
Oh, man.
So the consents for plastic surgery procedures, if you're going to a doctor who's board certified and is using the ASPS consent forms, are anywhere from 8 to 15 pages. If you're having a silicone breast augmentation, you're also going to have an additional supplemental 12 pages. So the
Just
consents...
think like redoing your mortgage length of paperwork.
Yeah. So it's like that. However, the one thing that I always tell people when they see this, and some people get kind of freaked out, especially when we used to use these on paper. We go way back to the days of paper charting. You know, they give them this like, stack of consent form and they immediately freak out. And what I would actually do is I would highlight where the difference between the risks specific, the word I cannot say, specific to this surgery, meaning your facelift, is about a page.
You know what's not unexpected? Your inability to say certain words.
Specifically certain words.
Every episode. Again, I want to reinforce, Amy's one of the smartest people I know, and I'm pretty darn smart.
You are. I'm just challenged.
You cannot say words.
Nope. Or the numbers. But moving on.
Okay, move on.
So
specifically, going to your point.
Specifically the pages. So, you know, it might be a facelift consent. It's 12 pages long, but only the very first page covers anything that is a specific risk of this surgery, meaning the rest of the consent, the rest of the 11 pages literally are risks of any surgery. And it says that, risks of any surgery. So trying to explain to someone that the risks of surgery are the risks of surgery, regardless of whether you are choosing to do surgery or not, does not mean that these major risks of surgery, including, you know, death, don't exist for you just because you're electing to do this surgery.
Right. The thing that gets really hard is when you get to the percentages of things like death with an elective cosmetic procedure. If you look at the percentage, or if you look at the statistics and break that down, that's where you can elucidate some of these things so people don't have to be as scared, right? You're more likely to die in a car crash just driving anywhere than you are to die from just general anesthesia, period. Okay? But that's a hard conversation to have with someone when they're in there because like, oh, this is so great. I get to have my facelift. This is like a wonderful procedure. I'm all happy. It's elective. And it always kind of rubs against it, you know, and people sometimes don't even want to have those conversations. Right.
Because it reminds you of the fact that you are just by the mere fact of having surgery, getting, you know, having all these risks associated. And most of them have nothing to do with the surgery you're actually having.
Right.
You know, they might be risks related to just general infection that can happen literally walking into the hospital. You go and have a Mohs procedure, a skin cancer removed, you get the same thing. You could have skin loss, all the tissue loss, nerve damage. All those things can happen anytime you're cut with anything for any reason.
Right.
So I think that's where you have to make the difference between, you know, understanding that these are just risks that I am taking by walking into this hospital or this doctor's office and having anything cut on my body. And these are risks specific to this surgery I'm having.
Got it.
It's saying specific and surgery at the same time that is challenging. So let's talk about
specific.
Some of these specifically unexpected things. These are things that happen. How about some of the acute ones? So these are very close to surgery. Bleeding. Or during surgery.
Yeah, bleeding for sure. Mm-hmm. Why do people bleed? Especially with like plastic surgery, your blood pressure goes real high. And some people have undiagnosed high blood pressure. We've had a few patients like that recently.
Or might have a clotting disorder that was not properly checked for before
Something
surgery.
Literally genetically wrong with them that, was not ever found previously. Hematomas, this pooling of blood, that can definitely happen with surgery. Seromas, this inflammatory fluid, that's very common for bigger procedures, liposuction, tummy tucks, body lifts, brachioplasties, arm lift procedure, even breast procedures, you can have seromas. So these are things that are a lot more common than people think of. These are definitively complications. Surgeons won't tell you that, but they are. But they are in some ways, not expected, but they're not outlandish that these could occur. Mm-hmm. And we do a lot of things to mitigate those or to have them not occur, but they may still happen. So in that case, if you're the patient, you didn't expect to have a hematoma, and then you do after surgery.
And your surgeon didn't expect that you'd have a hematoma either, but you have one.
Right.
Yeah. And those are things, bleeding issues usually are very close to surgery. We have rarely had a patient kind of have a weird breakthrough bleeding episode more than a week after surgery. That's very rare, but it can happen. Again, blood pressure changes.
Or I've had a young person, it was like 3 weeks after surgery, but like that was few and far between, maybe once or twice.
And it's usually like something else that happens,
maybe
like
they were
fall
moving
or
exactly.
Something's
helping their child out, something like that.
Or they have a blood pressure spike related to something, lifestyle wise or something.
Yeah.
But there's usually an episode, but other times, if we go way back in the podcast, and the day I'm wearing the purple shirt was a woman who 10 days after surgery showed up in our office, was having suture removal by our medical assistant, and our medical assistant came and got me, and I'm like, oh yeah, she's got to bleed. Way far out from surgery at that point, well after a week.
And you were just holding pressure?
Oh, yeah. And I just said to the medical assistant, can you go get Dr. Mark, please? I said it. And I told her to grab some epi on her way back and just to help pressure there. But by that point, the bleeding had exploded all over me, which I had, again, forgotten about until our medical assistant was reminding me. She's like, you were covered in blood. And I'm like, I don't even remember. I remember it, but like that wasn't even what I was thinking about at the time. Like the amount of blood that had splashed on me, I wasn't even aware of until we got everything done.
We just have an episode that discusses the stuff that you've gotten on your clothes working here.
No, please don't.
I feel like you've gotten urine. I don't know about feces.
No, thankfully, no. Nils got fat on his shoes.
We've all had fat on our shoes, Nils.
I've literally gotten...
You're not special.
Blood. We don't even go to that. Yeah, you're not special. We've all had fat on our shoes.
That's so common.
That is absolutely expected during surgery. No.
One of my favorite Amy stories was, it was like a small little procedure. It was something like taking something off, a soft tissue mass or lipoma or something really not cosmetic surgery related. And it was a man, and he came back in, and the area that we had operated on, it was fairly quick, within a day, within 24 hours, it filled back up with blood and it was probably within a couple hours.
Oh, this was the ballerina.
Yeah.
Yes. Oh my gosh, the epic, like we were in the OR for like 5 hours.
Yeah. And it was such a small little thing, which is really sums up medicine and surgery itself, because you could have I do all these huge surgeries, 7-8 hours. And of course, this little 30-minute thing, it starts bleeding. Obviously, it was not life-threatening. He was going to be fine. But when we opened that thing up, you got hit, didn't you?
Well, there's a better part of this story, because this happened not long after what I will the zombie blood incident.
Yeah.
I don't want to gross anybody out, but there had been a lot of bleeding. So Dr. Martin has a tendency to push on things.
Yeah.
He likes to poke stuff.
Right.
So there was a day where literally...
who doesn't?
Yeah.
Why do you think pimple popper is so popular? Right. That's human nature. There's something hardwired in us. You just want to, if it's blottable, you're like,
poke this. So there had been an incident not many months before.
I just want to make it real clear to anyone listening to this that doesn't know us. None of these people were in distress.
No.
We're not like... this so cavalier with someone who's really in medical distress.
Right.
Okay. These are totally stable people, not in a lot of pain.
And maybe I should say you were palpating it, not poking it.
I was kind of poking it.
Yeah. So
I was
anyway,
poking the bear a little bit.
yeah, the time before though, I mean, you were covered in so much blood that so Dr. Martin wears glasses. I literally had taken his glasses off and was trying to clean the blood off of them and put them back on him and was like wiping blood off of his face.
Yeah.
So that he could see what he was doing. So
If Instagram wasn't even around then,
No.
that would have been a great Instagram story.
oh my gosh. So that had happened. And then we get this nice gentleman in our office who I could see, was he came in, Dr. Martin had gone home for the day. So I'd called Dr. Martin to come back in, had it kind of prepped, and I just knew what was going to happen. You were going to come in, you were going to palpate this mass. So you were about to go into the OR, and I'm like, wait, put a gown on. And I made you put a gown on in the hallway. Yep. And
Did
so,
it save me? Did that save my clothes?
oh yeah, you were covered, but it was all on the gown.
Yeah.
It was great. Yeah, that was good times.
We don't get dirty anymore.
No, we wear gowns and shields and
Yeah.
everything else. Yeah. So that kind of leads into our next thing that is unexpected, but that can happen is a PE or a blood clot. And this is like a bigger blood clot, not the type of like little mini clots that you might get with like some bleeding right after surgery or hematoma that kind of causes your body to coagulate blood. Like, I mean, like a blood clot.
And pulmonary embolus or any embolus to the lungs is really a big fear in plastic surgery. We have a great episode on Brazilian butt lift, BBLs. It's a big risk there. It's actually fat. It's not a clot, but it's the same idea. And you cause a clot in your pulmonary system, right, where your lungs are, and you're unable to get oxygen into your system. Everyone knows you need oxygen to live, and it can be life-threatening and people can die. This is one of my biggest fears in what we do. There's so many things that I do. I have conversations with people after surgery. I'm like, you have to walk. Saw 2 patients today in the hospital. One of the patients, I said, sit up. You're not sick. You're going to walk. Okay. I was very terse with her because I wanted her to know this is important. If you don't walk and get that circulation going, you can get blood clots leading to a pulmonary embolus. Amy and I have been very fortunate in our career. There's no wood around. I can't believe, hold on. To not have this problem. But I think a lot of that is because we did have it early on. We had 1 or 2 patients and we learned, okay, that we did everything probably right, but we didn't go above and beyond for these patients. We didn't ask them the questions about home care, what they were doing. The patients didn't understand that they could call us if they weren't feeling right, And
Well, or their symptoms were just very odd. I mean, and that's the
both
thing.
of them were that.
Yeah,
But
PE can present with very unusual symptoms.
it's a very serious thing. And so in the rare cases that we've had it, the patients have done just fine. What they do is they anticoagulate them for 6 months, and then usually they go off the anticoagulation. But listen, being on blood thinners for 6 months, it has its own set of
Yeah, it
problems.
can really interfere with your life.
Big time. Especially in Colorado where everyone's very active. If you are on blood thinners, you can't go mountain climb. You probably shouldn't ski, to be honest with you. I think that would be really
but I'm sure they do.
reckless.
Yeah.
Probably
Sure
shouldn't even
they
get on a
do.
bike.
Yeah.
I'm sure they do too. But, so there's a lot of limitations there. That's a very unexpected outcome. It's rare. It's rare. I want people to know that. But there's so many different stories. I'm not saying anything wrong, but Kanye West's mom died of a pulmonary embolus after cosmetic surgery. If you're talking about people that die during an elective procedure, pulmonary embolus is probably one of the biggest reasons. Not during, but like afterwards.
After surgery. Yeah. So that's, they can present in unusual ways. I mean, and at any age. I mean, there is no age that is precluded from having one. And I think that's what can sometimes be confusing is young people can get them.
Both the people that we, in our practice, again, this is over 15 years, both of them were less than 40. Both or around
the other
40.
one was over.
Around
the
40.
smoker.
Okay. Well, there's 3. Yeah.
She was
the
like
ones
60.
I'm remembering were less than or around 40, fairly young, fairly healthy. Besides the one Amy's talking about. So,
Smoker.
yeah, and it's distressing. That's not expected.
No.
To be honest with you, just to be fully transparent, I mean, even thinking about those cases makes me feel uncomfortable. Yeah. That's how unexpected it was on my end. We're so fastidious with everything we do.
And I think the fear of missing one is what is, 'cause that's literally what keeps me up at night. It's just the fear that you miss a PE. I mean, we caught all of ours.
Oh, we caught them all because, ultimately the patients know, like, I can still call them. I mean, my fear is that some patients out there, I'm like, I don't want to bother them.
Then hopefully that person would at least be smart enough to go to the ER. But that's not our patient base. The not bother us people are not ours. But
we tell them to bother us whenever.
yeah,
and
but
we reinforce that.
They can have the presentation for PE can be unusual. So moving
it's
on
so funny. Isn't it funny that rare is the time when we do this podcast that I'm a little bit uncomfortable, and I
Talking
am
about
right now.
PEs makes me uncomfortable too.
I know, but it's just so. Surgeons are so bullish. Like I got this. I can do this, right? And the reality of it is, any action has an opposite effect, and no matter what a surgeon says to you, if you have a problem after surgery, it's probably related to the surgery. There's a responsibility for the surgeon on the surgeon. Now, if it's unexpected, these things can happen. I mean, if you have a pulmonary embolus after surgery, rare is the time you're going to be able to point back and say, well, he did this wrong or she did that wrong as the surgeon. That's just an odds. I mean, it's
just a complication of surgery.
Yeah, I mean, it's an unfortunate outcome.
Having a fat embolus is different. That's a surgical issue.
Right. Now, just one last thing with pulmonary embolus. I know this is not a pulmonary embolus episode, but there are some things you can do after surgery. You can give low molecular weight heparin. You can walk around or mobilize. You can wear SEDs or those squeezy. Do they have those at home?
You can get them for home use, and even just like you can go to rehab, like the rehab center we send people to, like they have them.
Yeah, Job's stockings, which are those real tight stockings. There's all these different things you can do, and if you do like all these big surgeries and none of those things happen, clearly that surgeon needs to be held accountable, because you need to give patients the ability to not form clots after surgery. Also, the medical history. If you're talking to someone, they're like, yeah, I've had 5 miscarriages and all this kind of stuff. There's things that you can pick out of people's medical histories. If you go to
known clotting disorders,
right? If you go to a surgeon and they don't even do a history and physical on you, then that's on them, right? With the surgery, if you get a clot afterwards. So, but it is very unexpected.
Yeah. So the other thing that's very unexpected, but not completely impossible. It's a word, impossible.
On the day I don't wear my glasses
You wanna play
and wear my
Scrabble later?
chinos, and I'm going on date night, what are you doing?
I'm going to Scrabble battle you
Okay.
later. Health status changes. So by that, I mean blood pressure drops, blood pressure increases, oxygen desaturation, those things can happen.
Today, both the patients today had O2 sats decrease.
Yeah. I mean, we had patients have to go home on oxygen.
The one today is going home on oxygen.
Yes. And you might have to be on oxygen for a week. Now, do we expect that? Absolutely not. We do not expect our patients to leave the hospital on oxygen. It does happen. Again, it can happen at any age. We've had even some younger patients who needed supplemental oxygen after surgery. Sometimes it's anxiety. They're not breathing. They're not taking deep breaths.
Any chest work, you don't want to. You don't have excursion of your chest wall. What's the layperson term for excursion, Amy?
Like breathing in and breathing out.
Yeah, deep breaths.
You're not expanding your lungs.
Yeah, because it hurts, and you do this thing
Or
called
you're afraid.
splinting. That's what we call in medicine. So, if you've ever had surgery, people listening, you remember this thing where they breathe in and then push the thing up? That's called an incentive spirometer. All that is to force you to recruit more areas of your lungs when you breathe.
Yeah. And that can be suppressed from anesthesia as well. So
Yep.
that trigger to breathe fully is suppressed during some types of anesthesia. So after, even non-cosmetic cases, if you've had certain types of anesthesia, they'll make you breathe into that until you leave the hospital to make sure that you're breathing enough. So those things can happen. Blood pressure changes can happen. Like you can have blood pressure spikes, blood pressure drop. Those are all responses to surgery when your body's under stress, and they can happen at any time. And we don't expect that. Our patients have normal blood pressure starting surgery. Their O2 stats are monitored prior to surgery. They've had an EKG. None of those things are expected, but they can happen.
We have had more than a handful of patients who are supposedly normotensive, meaning they don't have high blood pressure.
Taken in the pre-op.
They've taken it preoperatively. They've gone to a doctor. They're very healthy people. They go to a doctor every year. And they've ultimately they have hypertension. They have high blood pressure, and we didn't know it.
Yeah, and fluid changes like dehydration can affect that.
So they get filled up with fluid during surgery. When you're in the OR, you get a lot of IV fluids because the anesthesiologist wants to make sure you're well hydrated because you're NPO. You're not eating before surgery. It's the same old story, different day. And then you're in there, and then maybe you're getting liposuction, so we're putting in tumescent fluid. That gets absorbed in your system, and then afterwards, you're not moving around, you're not peeing, so all that fluid's is sitting in your system. You're already hypertensive, you didn't know it, your blood pressure pops up. It's like the same old story every day. And then it's so funny, I come into the hospital, and they're like, I don't know what's going on. I'm like, I know exactly what's going on. Okay, you were an undiagnosed hypertensive, and you got all those fluids in you. Everyone's looking around like, oh my God, this doctor really knows what he's talking about. But it's not. I mean, these are things that you see over time. even though it's unexpected for the patient, it's not outlandish that this thing could occur.
Yep.
And you could even say the same things about a pulmonary embolus, unfortunately. I mean, it's
or
possible.
hematomas or bleeding. I mean,
Yeah.
blood pressure can be very much related to those things too. So can pain. Like all of those things can kind of feed into it in
Right.
themselves. You know, they can. You get these
Are we
little
going
like
to talk about
feedback
anything
loops.
good here? I
We
mean,
are.
Okay.
So complication from anesthesia is the last one I'm going to put in that acute category. And these are things that you would expect within, you know, I'm going to call that within a few weeks of surgery.
Listen, postoperative nausea and vomiting, PONV. If I say that to someone who's listening right now and has it, they know exactly. They know what I'm talking about.
Yep. Nels knows.
I mean, it is devastating. Like this.
It's by far worse than any type of recovery from surgery.
I tell you, I mean, my hernia surgery, I talk about this all the time. I wasn't right for 3 days. I don't even know where I was.
And you had mild anesthesia.
Mild for an hour. I remember I made a phone call to one of our business partners, and the next day he said, I just want to tell you that I didn't understand what you were saying when you called me.
When you were in the upside down world.
In the upside down world, I had half a Percocet, okay? I'm almost 200 pounds, so it wasn't like I was like high on Percocet. That's all I had. I don't know where I was. I didn't expect that.
Right.
Clearly, I didn't expect it because I was making business calls.
But is that unexpected?
No, but it is unexpected because the unexpected part is me personally as the patient. I did not expect it.
I wouldn't call that a complication for anesthesia, though. I'm talking more about the things that are true complications for anesthesia, like headaches, dryness of the eyes or throat. We've had patients who are very hoarse for
not
days.
being able to talk. This is definitely a complication from anesthesia.
Very rare. You can get corneal abrasions if the tape is not placed correctly over your eyes.
Your arm positioning, maybe you get numbness in your arms.
Yeah,
we get that a lot.
Patient with compartment syndrome after surgery and like ulnar compression. So there are things that can happen during surgery that are not related to your surgery, but are related to the anesthesia or the way you were prepped or draped. You know, if you have an injury going into surgery, you can definitely lose your false eyelashes. I'm kidding on that one.
No,
it's true, but
it is true.
Yes, but I'm somewhat joking. But those are things. I mean, people who have like really, really bad sore throats for days or have really bad headaches. The nausea can last for extended periods of time.
Sometimes we do epidurals. It's rare these days, but sometimes we do epidural headaches are a real thing. If anybody's had, delivery, pregnancy.
Again, people who've had that, for sure.
That could be a real problem.
Yeah.
And there's so many other things that go along with anesthesia. We should actually just do another episode on anesthesia because we could just talk for an hour on anesthesia alone.
And those things, again, the anesthesiologist will tell you those things are not expected, but are they things that are outside the realm of possible? No, they can happen and they're frustrating and sad when they do. Like it can really delay your recovery when you're dealing with a lot of nausea. If you have this really scratchy throat for weeks and weeks, if you have a corneal abrasion, like those things can absolutely delay your mental recovery too.
Mm-hmm.
Like of just feeling like you're more injured than you are.
Right.
So that's, So those are kind of my acute ones. So those are things that happen like close into surgery and or during surgery, like close to surgery. There are longer term complications that can happen too. Like things can pop up later on time. As we talked about, normal expectations of recovery is months. So what can happen during those months of recovery? You brought up a really good one earlier.
Which what did I say?
Capsular contracture.
A capsular contracture, of course. Yeah.
Yeah. We looked
Which is scar tissue around an implant.
Yeah. We have a couple of great episodes where we talk about complications related to breast implants specifically, but that's one that is a specific one for breast implants.
Actually, Amy, it's referred to as breast implant controversies.
Yep. Scarring. Scarring can go weird, right? You can have a scar that's looking really good for a few months, and then 6 months in,
it's crazy looking.
it gets nuts. Like it stretches.
Like what is going on?
Yeah. You start
Proliferates,
spitting
hypertrophic,
suture.
and worst case scenario, it's keloiding.
Yeah, which is very rare.
In our patient population, at least. So, but it's scarring is, I remember in training, there was a guy that taught us, the trauma surgeon, and he was really smart, and he would go to these scientific mathematical conferences about chaos theory.
Oh.
And part of that, and I know I'm not doing this of service, like whatever he was doing. Part of that was talking about trauma and healing, because there's healing, the cascade in healing was so complicated that you would need to bring in these mathematicians to help us understand everything that's going on.
Oh, that's what AI does now for medicine.
Exactly.
Yeah.
This was pre-AI.
Yep.
So now you're seeing this. So that's how difficult, that's how complicated wound healing is. It is crazy the amount of stuff that's going on, the amount of interactions, almost in this like factorial effect of everything just going out. And so it is weird to watch people clinically heal, and almost all, and at least in our hands, they heal just fine. Sometimes these people, they go in these weird directions. But if you actually take a step back, there's hundreds and hundreds of steps that are interacting with each other when you're healing. It's not outside the realm of possibility that one of those steps could be disarrayed.
Yep.
And then all of a sudden their scar starts to change. And we've seen it. We have seen it. I don't have a lot of explanations for that. It's hard for the patients. It's hard for me. I feel a sense of loss and frustration with them. You can fix those things, and we do.
Well, it's especially shocking when you have not seen someone for like 3 months. They come in for their 3-month
Right.
post-op. Their scars look great. They come in at 6 months, and you're like, well, what happened here?
What happened? One of the things that doctors do that I hate, they always say, well, what were you doing? Right? Like somehow the patient was out like on the Sunset Strip, like exposing their scar to the sun and like, I don't know, drinking or something.
Maybe they were.
I know, but most cases they're not. Like in reality, we're human beings don't really understand complexity, and they definitely don't understand complexity when it comes to wound healing. So it makes sense that you're going to have a small subset of patients that look okay at first and then start to not heal well over time.
Yeah, which is very rare, but does happen. Persistent swelling I put on here because as much as we talked about swell health being normal, and it is, there are people who can have unusual compartmental swelling for like even a year after surgery, and that is not expected.
No.
Now, is it mean your body is doing something wrong? No, it means your body is being slow. You do kind of want to figure out why that person might still be swelling. But, and again, that leads to the frustration, like that's not expected for anybody. Like that's going to really frustrate a patient. Like, oh my gosh, like I'm super swollen now. It's been a year, shouldn't I be over this? So not expected. Need for additional surgery. We tell all of our patients, and that is on all of our consent forms as one of the known risks of surgeries, need for additional surgery, no matter what you're having done. I always say you can never go back. Dr. Barton said one time, what if you put an implant in and take it right back out? I said, you still have a scar you didn't have before because you can never go back.
That was a good point.
So need for additional surgery.
I thought I had you on that one.
Yeah. Still a scar.
So simple. Yeah. It's like such a simple response. The best answers are always simple. It's like if you say something, you're like, oh, I'm so smart. And you just say something simple back to them. And then it's like, what else are you going to say? Well, yeah, they have a scar. They never had a scar there before. Because I wasn't thinking about the scar.
That's part of it, though. That's the part of never going back. So need for additional surgery is real. It can happen at any time. Your insurance will likely not cover it. This was an elective procedure. You may be putting out a lot of money for additional surgery in the future, either by choice or by maybe somewhat necessity. You need to have a scar fix because it's doing something weird.
One of the byproducts of becoming successful in plastic surgery is you get a lot of referrals, and you get referrals of people that have had unwanted outcomes. And the feelings of this frustration there are palpable with those patients. You feel for them, but you also say to them, look, hey, I feel for you, but we got to take care of this problem.
Well, and it doesn't mean that this surgery will fix it either.
Exactly. And that's the next conversation is like, I'm not convinced that this is going to solve the problem, but I wouldn't do surgery unless I know it's going to make it at least a little bit better.
Yeah.
And that's hard. That's a hard conversation.
Yep. But it's always there. And need for additional surgery doesn't necessarily mean it's a bad thing. Like you might just want additional surgery. Right. So, that's, yeah. All right. I think we covered those well. Let's take a quick break. Listen to a word from Let's Get Checked.
It's 2022. What's Let's Get Checked? Bring it to the table now. What are we doing now?
They actually do have some new stuff. I can't at the moment remember what they just emailed me. Actually,
okay,
they were doing a thyroid.
We're going to check our emails while you listen
thyroid
to this
panel.
ad.
Yeah, let's get checked.
Let's get checked.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically, you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where two of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC. So TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
Yeah. All right, we're back.
We're back, Amy.
Okay. So we've talked about...
I've been squirming a lot in my seat with these conversations.
That's because no one likes to talk about what's unexpected.
It's hard. It's hard.
But it's important. So here's the really important part of this episode. What do you do when you have a non-traditional recovery? I'll call it non-traditional recovery. Like when one of these unexpected things happens to you.
Non-traditional recovery?
Non-traditional recovery. I mean, that's what it is, because it's still, your recovery is not bad or wrong or whatever. It's just not traditional. It's not even abnormal. It's just not traditional.
Not traditional. Okay, we'll stick with that.
Or the non-common recovery. So I think the big one is my top one actually would be manage your expectations. And how do you manage your expectations? Well, you need to ask your doctor and his support staff what to expect given your unique circumstances. And it's not the same for everybody. No two tummy tucks are alike. No two complications are alike.
They're like snowflakes.
They are like snowflakes. No two hematomas are alike. No two PEs are alike. I mean, even these things that are unexpected, they're still not the same for someone else that they are for you. Your surgery is probably different. Your health is different. Your lifestyle is different. All those things are different. Like your ability to adjust and adapt to this unusual incident are different. So I think that is really the key one.
Yeah, communication with your surgeon, I think, is the most important.
Yeah,
I agree.
Because they're going to be the ones to tell you what to expect. The last thing you want to do is go on Google and ask them what you should expect, because Google doesn't know you as well as you think.
I've established that I love the Facebook groups and I love the Swell Health group for tummy tucks, but the problem with talking to someone who doesn't have an experience, doesn't do this for a living, and then you talked about only their experience, they're going to give it through their eyes. And if anything has shown us in the past 3 or 4 years that talking to people about their own experience isn't always helpful for yours.
However, it can be.
It can be more emotionally in a lot of ways, but trying to compare apples to oranges just doesn't work. And that's where your surgeon, who hopefully knows everything about your past medical history and your recovery and where you're going, can give you at least some estimation of what's going on, what to expect in the future once one of these unexpected things occurs.
Yeah, I think a good example of someone who had a really awesome support system was a patient who'd had a breast augmentation, with us. And then her friend had breast augmentation with us about 3 or 4 weeks later and had a post-operative complication. And her friend was able to say to her immediately, this is not what I experienced. Let's call. And it was a good thing that she did. So, there are definitely times where, if someone says to you like, wow, that was not my experience, at least ask your doctor if that is expected for you. I wouldn't ask your Facebook group if that's expected for you because they don't know you. But if someone is saying to you, this is not normal or this doesn't look normal to me. And trust me, I get a lot of patients who come in and say to me that their friend, who I'm sure is a doctor, says that shouldn't be happening. I'm like, actually, this is totally normal. This is what should be happening. Like, thank your friend for their helpful advice. So
I feel like friends are nice people, but the ones you're alluding to really annoy the living crap out of me.
Or who think that any discharge from an incision is an infection.
Like you have an infection,
yeah.
or you need more pain medication, or you're not supposed to swell like that. This is postoperative day number 3.
Yeah.
Really, friend? Really?
Yeah.
Can we just have like a week where we bring all the friends into our practice and like I treat them like fellows. I just teach them.
They don't want to learn. They want to
just complain.
Yeah. They want to tell other people what to do.
All right.
And Google is probably not the best place to look. I mean, even just within the last week, I had someone tell me what they read on Google was directly contradicting what I had told them in person to do. And I said, I appreciate that you found that on Google. However, in this particular circumstance, I'm going to need you to do what I told you to do. Please.
Right.
Respectfully, please. So communication and finding out, how your recovery might be different from your best friend that had the same surgery or from your, whatever, is going to be the best way to help manage your expectations for your non-traditional recovery. And then lean on your support system. I think this is also where people, maybe you only plan to have, help for a week, but your recovery is now going to be meaning you need help for 4 weeks. Don't be afraid. Like you need to find those people who are going to help you because your recovery is now different. Right. And that's hard to adjust for and adapt, but it's important to find those people to be your support system, whether it's your spouse or your friends, explaining to them that like you need more help than you anticipated.
Yeah. That's the one that like you feel for these patients when they have to like ask for more help. Yeah. You could just see it in their face. It's hard.
Well, they don't, or hire a nurse. I mean, some people don't have that. Maybe their best friend or sister flew in and is flying home and can't stay.
Exactly. That's what I was referring to.
Yeah.
Yeah. So you feel for them, but you just got to get it done. You got to take care of business.
Yeah.
Get through it.
And most importantly, keep your post-op appointments. And I think this is where it gets frustrating for people, right? You've had a long recovery. Like you are sick of coming in every week and you don't think maybe it's important and you feel like you're maybe doing fine or nothing's changed or you're feeling really frustrated. All reasons to keep your post-op appointments. That's really where it becomes challenging with people. I mean, we can't force you to come in. We can't go to your house and like drag you into the office.
Oh, I can.
There have been times.
I'm a doctor.
Yeah.
I'm a resplendent plastic surgeon.
You are.
I'll show up in my 3-piece suit and my monocle and my cane. And I'll tap on the door. Time to come in.
Yeah. But
sorry, Dad, just ruin your vibe.
No, Mr. Peanut is what I'm picturing now. So if that's the vibe you were going for, you got that.
Yes.
Yeah, you're being Mr. Peanut.
Now we're showing
there.
your age because Nils is laughing.
Yeah,
you're laughing because anyone under 40 does not know who Mr. Peanut is.
How many patients of ours are under 40? Not many.
That's true.
Yeah, a subset, but I'd say 75% are over 40 and they know who Mr. Peanut is. Yeah. Mr. Peanut still exists. Like, do you think that no one under 40 eats peanuts?
I know, but like, I don't know. Yeah, I just don't feel like I'm going to go home and ask my kids if they know Mr. Peanut.
Maybe just show them a picture and be like, do you know who this is?
Maybe I should do that.
That's Mr. Peanut.
But without any wording on it. Like, who is this?
Just the picture. Mm-hmm.
Like, who is this weird looking peanut dude
very dapper
with
peanut
legs
with a monocle and a cane?
Like, how does Mr. Peanut keep the monocle in? I mean, how does...
He has eyes.
Well, not really, because a peanut shell doesn't have a lot of flexibility.
He also has hands. So in this scenario, this peanut has arms and legs.
Right.
To carry a cane and keep his monocle in place.
It's a chimera human peanut. Mm-hmm. Yeah.
Yes. We have gotten off the rails on this episode.
That's okay.
So it's important to keep your post-op appointments because it's how your doctor is going to help you manage your expectations and how you yourself are going to continue to manage your expectations.
So, again, we only can come from our personal experience, but we really try to wrap around our patients if things are unexpected and tell them that we're here. We want to be a part of the process. I think it's really easy for you to get frustrated.
Or feel very secluded and isolated.
Or feel like, why did this person do this to me or whatever? And that's okay to have those feelings, but you need that person at that time. If there's any time that you need your surgeon is when things are unexpected. Mm-hmm. Assuming that surgeon cares about you, is doing the right thing, is competent.
Which you chose this surgeon. They should be all those things.
Right.
Listen to our episode about why board certification matters.
Yes. So it's a hard time. Like, I think you need to put those feelings in their place and lean on the surgeon and their staff at that time of need, right?
'Cause we've had patients who've had delayed wound healing for months. And yes, that gets very fatiguing. Like when you spend all summer not able to get in the swimming pool with your grandkids because you have this open wound that you're trying to hide from people. I mean, that can make you feel like very isolated and very much like a freak and very, like it's never going to heal and it's never going to go away. And they don't know. I mean, you're an N of one. It's your own, I've never dealt with that personally on my own body. I've seen it on other people, so I can speak from that experience. But I don't know. There are sometimes I think, man, how would I feel in this specific situation? Someone who might have extreme bruising, and I think, wow, like that is tough.
No, I don't. I try to. I mean, it's hard as with the surgeon mentality, but I try to put myself in people's shoes and try to be as compassionate as possible, sympathetic when I can, and empathetic if I've ever experienced that. Yeah. So, I think it's really important that you lean on the office that you utilize for your surgery when something's unexpected.
Yeah, absolutely. So what are some advanced recovery options? We've talked about some of these things before on our podcast episodes about recovery, but these are things that, you might not have planned on doing. However, if you do have one of these unexpected situations come up, these things will be very helpful to you and can really minimize some of the downtime that you might experience otherwise. One of the things that we haven't talked about a lot before is hyperbaric oxygen. We actually had a great podcast where we were talking about research we were into where yours was about hyperbaric treatments for telomere extension.
Telomere extension, yeah. Come on.
But one thing they absolutely will do is help decrease swelling and improve the body's ability to clear out bruising remarkably well, because it just helps. The oxygen is kind of forced. The pressure is forcing fresh blood into those tissues and helping clear out bruising much quicker. So that one is something I would highly recommend if you have a bleeding
And you think
episode.
about what does the body need to heal, Amy, besides all the nutrients that we've talked about 1,000 times before?
I mean, every cell in the body needs oxygen.
Oxygen, right? That's why smokers don't heal.
Yep.
That's why diabetics don't heal, because they literally cannot get oxygen to the wound. Okay. People that have diabetes, their small, teeny tiny blood vessels are not really competent or great.
Because they're all sticky with ages.
And then people that smoke, the nicotine or whatever, that process leads to this loss of the small blood vessels. And those small blood vessels, teeny tiny microscopic blood vessels, is what brings oxygen to the areas that need it. Oxygen is really important. That's why hyperbaric oxygen is only positive for wound healing, period. So
yeah, and you can go into a hyperbaric chamber with drains in place, like with stitches still in place. It's not like some of these other therapies that you might have to wait. Like you could be doing hyperbaric the day you're released from the hospital.
We just had a patient do HBO recently in the past couple of weeks. She had bad bruising and
remarkable
improvement.
Yeah, so powerful. Acupuncture is another one that you can start pretty much immediately after surgery. I mean, they use acupuncture as a substitute for anesthesia in some countries where anesthesia may not be available. Acupuncture can be performed immediately after surgery.
I'm just telling you, if I had a choice between acupuncture and anesthesia, I'm choosing anesthesia. I don't know.
I don't know. I mean, if you're on a battlefield, the choice is acupuncture or nothing.
The one time you made me do acupuncture, not the one when I had the back problems. I did acupuncture one time, and I was like, this is fine. But I don't see how you could do that over anesthesia. Am I just way too Western
What
medicine?
I'm saying is if you had no anesthesia or acupuncture relief, which would you choose?
Acupuncture.
Exactly.
Thank you, acupuncture.
Yes. So acupuncture is really powerful again.
I love you, acupuncture.
Yes. For helping to bring your body kind of back into balance. So if you're having compartmental swelling.
You and I are so different. I'm so Western medicine. I was like IV sedation, surgery, and you're like, no, cryotherapy, acupuncture.
You're like, give me the club.
Massage. Yeah.
Can you just knock me out for this?
All right. That's not what this episode's about.
No. So acupuncture is going to be very helpful. Again, you can do it with drains in place. You can do it with sutures in place. Very, very powerful in helping with not only with swelling, but also in kind of getting your body to clear out the effects of anesthesia. If that's what you're struggling with, is postoperative nausea, hugely helpful for things like that.
Yeah. I can see around the ears and stuff like that with the acupuncture and the nausea.
And just for the mental acuity too, kind of helping you clear your head, acupuncture is great for that. Lymphatic massage is something you might, not be able to start right away, but we've talked a lot about the benefits of lymphatic massage to get those lymphatic flow moving, help with bruising, help with swell help in general. Touch is powerful. Cranial sacral is something I've never brought up on this podcast before, ever. Do you know what it is?
No. I know you always say it all the time. To be honest with you, I think I threw it out to a patient one time just because I thought that's what I was supposed to say.
Well, then I'm sure it helped. So craniosacral is a type of therapy.
Is that the one where you stand across Reiki, where you stand across
Reiki.
the room and you like hold your hands out and do the positive energy thing that you love?
So craniosacral literally is body work that's addressing the flow of cerebral spinal fluid, the CSF, cerebral spinal fluid, around the brain, and then along the spinal column down to the tailbone. You would hate it. I mean, like, I will do some cranial sacral on you and you'll be like, this is literally the worst, because, the practitioner may have their hand under your occiput, right at the base of your head where you hold the newborn baby, and then also a hand on your sacrum, and be doing some energy work to balance out your cerebral spinal fluid. So if you've had, maybe some of these anesthesia related issues, like you need a patch after your epidural, again, cranial sacral, very, very powerful, can be done right away after surgery. No real contraindications there.
Yeah.
So really,
if it helps, it helps.
Yeah. You do need, for lymphatic and cranial sacral, it's important you find somebody who is well educated in these things. While I do have some education in how to do cranial sacral, I would never call myself a cranial sacral therapist.
Does the cranial sacral therapist also do tarot cards at the same time?
Only if you're really lucky.
Okay. Just wondering.
I'm going to come hit you on the head with some sage later.
You know what's good? It's definitely going to happen. I'm going to hurt myself and absolutely need a craniosacral person.
You're going to have some type of closed head injury or trauma.
Exactly. It's going to be the one person that could help me.
Yeah.
And they're going to be like, listen, you son of a bitch.
Oh, my favorite.
I listened to that episode 116.
Gentle pressure on the frontalis, or on the bones of the front of the head. And I remember when I'd be doing these sessions, I would picture that I had tiny little magnets on the tips of my fingers. And then I was lifting the bones up off the head. Love it.
Yeah, but that's just like when when you make me go to the fancy place for the hair, and they wash your hair and they scrub, they do the fingertips.
Yeah,
that's just like massage. That just feels good.
It's not, you just hold it and you're sensing the cerebral spinal flow and helping to balance it. Right. Years. Oh yeah. So it's great. Some of the things you might have to wait a little bit longer to do are things like cryotherapy and some laser treatments on your scars. Those things need to be done a little bit farther out from surgery, specifically cryotherapy you cannot do if you have drains in place. Obviously, right. Your drains would freeze and that would be really bad. You're in a tank of liquid nitrogen that's very, very cold.
All the serosanguinous fluid in the drain tube would freeze.
Yeah. Oh my gosh.
And then maybe explode, right? Because doesn't it expand the water?
It would expand, but there's room for it because you're swollen. There'd be room for it to go. But yeah, that'd be very uncomfortable. And also most cryotherapy won't let you go even if you have sutures in place, because that same thing, you could still be leaking, you could have oozing. They want your incisions to be closed, which depending on what type of advanced recovery you're having or non-traditional recovery, you might not be a candidate for cryotherapy for months.
Yep.
So that one's an out there. Same thing with laser. You don't want to start. We had a patient ask if they could CO2 their scars less than a week after surgery. I'm like, no. You got to give these scars a chance to heal before you start hitting them with a laser. So even some of their scar treatments, we've talked many times about our patient who was putting scar gel on her facelift incisions the day after surgery and caused a crazy surface spreading skin infection.
Oh, that wasn't scar gel. That was blessed oil from her shaman.
Well, but then was putting the scar gel over the top of it to lock it in.
Oh my God.
Yeah. That's how I knew, because I peeled off the scar gel. I'm like, what have you been putting on these?
I know.
That's how I knew what was going on.
That may be the most angry I've ever been in a patient and then I immediately
but she ended up in the hospital having an IV
no, of course,
antibiotics
that's my
for days.
point. Then I felt so bad for her.
Yeah.
It was just really, she didn't mean it at all. So she was doing what she thought was right.
Yeah. And if she'd been doing the oils alone, would it have caused as many problems if she had not been doing the oils with the occlusive scar gel on top?
It may not have caused an infection.
I think it might not have. Yeah. That's why our post-op instructions now say in bold letters, no silicone scar gels or tapes.
Right.
So, because they trap stuff in. They are occlusive.
They're very occlusive.
Not a great environment for healing. Again, oxygen necessary for healing. You don't want to just make it an aerobic environment. So homeopathic and supplements, those things, in some cases, we have our patients do homeopathic treatments prior to surgery. T-Relief is a homeopathic for bruising and swelling. You get that from us. Other supplements that might be recommended.
Sponsored by T-Relief. Who makes T-Relief?
Oh, it's been bought by so many different companies now. Yeah. It used to be this Canadian pharmaceutical company. I'm not sure who owns it now, but it's a great product.
We supply it all the time.
Yeah. Or I put supplements on there too, right? Nils, the almighty $. Supplements. People who might be having.
You don't have to pay us money. Just send us a T-shirt. I'll wear it.
Yeah. Someone who might be showing symptoms or signs that they were developing a capsular contracture. There is a medication that can be given. Also, there is some anecdotal evidence that high-dose vitamin E can be powerful in those first kind of months of surgery. Vitamin E can also be good for people who do tend to keloid. So communicating these things with your doctor before you start. Please don't start taking supplements or medications without talking to them. Might be added in and might be beneficial. And I always say I'm a nutritional therapy practitioner. I feel like I'm talking a lot right now.
No, you're doing good.
Okay. Neil says it's fine. It's okay. I never say
it's your podcast.
Right. Well, I don't get to talk much about stuff that I do. We usually talk just about surgery. These are
to be
things
honest
in
with
my
you, this whole
wheelhouse.
episode, this is the most interesting stuff to me.
These are things in my bubble.
Yeah, I know. But these are the things that people don't talk about in plastic surgery that are at people's disposal. And if you are a person that has an unexpected, non-traditional outcome, to know that you have options that can help you is like huge.
Yeah.
So this is really probably the most important part of this. So keep on talking, sister. I'm with you.
So supplements specifically, there may be something that will make your recovery better, but it's never going to be magic. Supplements are not. And that's why I always tell people, if this is any of these advanced recovery options, some of them are pretty close to magic. Hyperbaric oxygen for bruising is pretty magical. Cryotherapy for persistent swelling, again, very powerful. Acupuncture, all these things I think are very powerful. However, at 6 months out from your adverse event, are they going to change how you look? Probably not, but will they make your recovery a lot better? Yes. So if you can afford these things, they're cost appropriate, they're time appropriate. Highly recommend you talk to your doctor about seeing if you can add some of these things in. And what do I always say?
Tincture of time.
Time heals all wounds, and that is so true. And time is not what you expected. There was a podcast where I said time a lot, and it really irritated you because I just kept saying time.
Yeah.
It's time.
That's impossible that you would ever irritate me.
I think that's completely possible.
Impossible.
Possible. Time. And people don't like to hear that, especially if you've had something that's maybe delayed your recovery. It's going to take more time. And that sucks. But time really does. And, when someone's like asking about maybe a scar that's still red, how long is this going to take? No one wants to hear it might take a year, but that might be the answer. And setting your expectation is going to help with the mental part of recovery a lot.
The mental stuff is the really thing, the big thing to overcome. Because most of these problems that you're going to have, they will overcome, they will go away, and you will be fine. Mm-hmm. So rare is the time that you're going to have some long-term issue. It's possible, but rare.
Possible. Yeah. So that's what I had today for what to do when something unexpected happens.
It was really good.
Yeah.
This is not what I expected.
This is not what you expected this podcast to be like?
Podcast, and literally looking, even after the first slide, I was like, oh, we're just going to talk about the stuff we talked about before, but that's not really what we were talking about. We were really talking about unexpected complications that even the surgeon wouldn't think would occur, right, in many of these cases, and kind of work through that. And then we talked about, options. It's interesting. Very good.
Yeah. So we brought it up before, but we would love it if you'd leave us a voicemail. We do check them. I check them. You can also text this number.
So Nils usually puts it down here. And
he always puts it down here.
No, right.
303-630-9038. So we love it. If you go back and listen to some of our episodes where we listen or where we answer questions, some of those are voicemails. So you can literally hear your own voice on our podcast.
By far my favorite.
We love them.
The year end and those episodes are my favorite episodes.
Yeah.
For sure.
So we love your questions. If you have ideas for podcast episodes that you'd like to hear more about, please let us know. We love it. So, and also leave us a comment, a rating, review.
And subscribe.
Helps us out a lot, especially if you are on the iTunes podcast app. That's where all that good stuff comes from. And on YouTube, you can find us at Jason Martin, MD, at Beauty and the Surgeon Podcast on Instagram, and Podcast Review Podcast.
Podcast Review Podcast. What's that?
Podcast wherever you find your podcast.
Oh, okay, I got you.
Yeah, because I listen on Podcast Republica. You probably listen on the iTunes podcast thing.
Yeah. I'm all up in the Apple ecosystem.
Yeah, I know.
I mean,
Spotify, anywhere.
Whenever they come out with their virtual glasses, I'm just going all in. Like I'm going to be living in the Apple iPhone.
You're going to be an iPhone.
Yeah, I'm just going to be living in there.
There's some
like, kids, you can come get me in my virtual Apple world.
So next year when I'm sitting next to an iPad.
Exactly.
Yeah.
It's just going to be me at home.
Yep.
Locked into a very comfortable seat.
Oh, that's the joys of the future.
I know, it's totally a joke. It's just, that really is actually seriously distressing.
It's very sad. Yeah.
Well, good talk about that.
Thank you everyone for listening so much. We do appreciate it. And we hope you hear us next time.
Have a great and expectedly great day.
Yes.
Yeah, okay. See ya.
Me fail English? That's impossible.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.